Ackerman. I'm with Lebanon Physicians for Women. I've been in Lebanon for 20 years now. Delivered about 4,000 or more babies since I've been here. I like OBGYN because it's the one field of medicine that is usually very happy. People are happy to be at the doctor. They're excited to have a child. It's a very happy time in their lives, and I'm honored to be able to participate in it. I also get to do a lot of surgery, and I like doing surgery on people, and I like really helping people that are having trouble and get really good results from doing surgery on them. So those are the two things that led me to OBGYN. Did undergraduate work at the University of Dayton, got a degree in electrical engineering, was an electrical engineer for 10 years, and decided to go back to med school after doing it for 10 years. Went to University of Louisville, did a residency at University of Louisville, and when I graduated residency, I came to Lebanon. I got out of residency, and Dr. Reynolds and I were looking for a place to come together. Lebanon had a really nice hospital. I have a lot of family in this area. My mother is actually from Loretta, and so it was an easy choice. We do, of course, all the routine care for obstetrics. We do all of the routine care for well women. We do hormone replacement therapy. If people are having difficulty with their menstrual cycle or periods, we take care of that. Pretty much anything in the realm of OBGYN we take care of. We get very excited about taking care of patients. They call up here and they tell us that they are with child. We get them in pretty quickly. We take care of every aspect of the pregnancy. We do our ultrasounds here. We have a wonderful ultrasonographer. She is very skilled at catching any problems. We have a great referral network if somebody does need some additional care, that we're able to take care of that. We're also able to take care of complications of pregnancy such as diabetes. We follow the pregnant women all the way through delivery, and then postpartum. Everybody can get all of their care here in one place and not have to leave town, and they get care as good, if not better, than anywhere else by board certified OBGYNs. When I first came down here, we hired most of the staff of OBGYN that was down here, and some of them have parted ways. One retired, but we still maintain almost the whole entire staff. The people that have been here have worked here for many, many years, and everybody knows their job and knows it well. We have an absolutely fantastic and well-experienced staff. We have a few new members that are working out really good. Not only are they motivated, but they have people with a great amount of experience to be able to train them. It's just wonderful to be able to work with people that have such experience and motivation. I don't even have to think about what to do when I go into a room, because they're very helpful to me and they're very helpful to the patient. I've had people that I've taken care of when they were teenagers, and then they've decided to have children, and I've taken care of them, and Dr. Reynolds and I, and now Dr. Hutchinson, have delivered children to them. Some of them have needed surgery after they've decided not to have children anymore, and even some of the children that I have delivered 20 years ago have now had children. It kind of makes me feel like a grandfather in a way, but that continuity of care, that seeing people from teenagers into middle age, taking care of people that I delivered, it's just really an honor to be able to do all that for a family. Dr. Hutchinson joined us here in September. We're very glad to have her, and it's been great working with her. There's a great deal of benefit. First of all, some of our patients would prefer to see a female OBGYN, and that fills that service. And glad she's able to provide it. She is very caring to the patients, has adapted very well to being able to take care of our patients with us. We have no worries when she is on call. It is a little bit less call for us, which being on call can be very trying at times and tiring, and so it allows us to be a little more rested and probably be a little bit better physicians because we take a little bit less call.
Hi, my name is Stephanie Hutchison. I am a physician of obstetrics and gynecology at Lebanon's Physician for Women. Originally a country girl raised in rural West Virginia. Actually, I'm a non-traditional student. Initially, I was at Marshall University doing my undergrad, and I was married to my husband, and he became a security police specialist, and we were living in Germany during the Desert Storm. Then once he came back, I started school again and had children, and started school again and had a child, and then I decided that I really wanted to be a physician. Initially, I went to Marshall University Medical School because they had a wonderful rural family medicine program. However, once I was in medical school, I really enjoyed the attention to women's health issues, and also more surgeries and things like that they have. And I found the longer that I was in obstetrics and gynecology, I had a love for dealing with cancer patients, also with incontinence issues, pediatric, and even adolescent medical problems. And I just felt a great love for it. I also have had a mother who's had vaginal vulvar cancer, and so that also helped, and I wanted to be able to better help the community, especially our females. I'm very happy to be the first woman obstetrics and gynecology physician at Lebanon Physicians for Women. It has been a wonderful clinic, been around for 20 years, and has been blessed to have Dr. Ackerman and Dr. Reynolds. But I'm very glad to have a women's touch, especially for some of the women who are uncomfortable having a male physician, and that way they're more comfortable coming to a female physician. As far as obstetrics and gynecology, I have a wide range of loves. I am especially blessed that I was able to get training in residency to do pediatrics gynecology and also adolescent teen. However, we also had a very strong urogynecology program there, so I was able to deal with pelvic floor issues with women like incontinence, or what women have problems with their bladder falling down or the uterus falling down. And where I went to Eastern Virginia Medical School in Norfolk, Virginia, they also had the Jones Institute, which was the first place in the U.S. where they had the IVF babies. So I was very fortunate to have some infertility training also during my residency. Another one of my areas of expertise that I like is minimally invasive surgeries. My mother and all my aunts have had to have hysterectomies, but I'm very happy that we now have many alternative things to major surgery. It can be like an IUD, or it could be just a minor outpatient procedure. It doesn't mean that we have to have major surgeries now for every female issue. I'm very happy to also bring my knowledge of pediatric and adolescent care, whether it's, with irregular periods, painful periods, or even with infants who have gynecological issues. And especially with our pediatric and our adolescents, a lot of them are extremely uncomfortable seeing a man, and I'm glad that I can offer that to them. Minimally invasive procedures is one of my specialties. It can be whether it's E-Sure, as far as an option for sterilization, or it can be like the IUDs, but also I now offer MyoSure, which allows me to remove fibroids from inside the uterus and without having to do a hysterectomy, and also I do endometrial ablations for heavy bleeding. So this allows women to actually have a procedure and go back to work the next day. It's not a long process to where they can't get back to work. Also, I am offering here for incontinence the urethral slings, so that I can better help women with a very embarrassing issue, but a relatively easy surgery, and patients go home the same day. I especially love my job because it can be anything from starting at pediatrics to adolescent to women as they're trying to conceive and have children, and then later also deal with the same women when they have menstrual problems or fibroids or incontinence issues. So it's a wonderful to be able to see the patients through the many different stages of life and be able to help them through these stages, whether it's hot flashes or painful periods. And now, as far as fibroids and things like that, I'm actually able to offer other procedures that doesn't necessarily mean that they have to have a hysterectomy, or procedures that I can do for fibroids that will help in fertility for some of our patients.
Being here in Lebanon has been quite an honor. I'm back among my family on my mom's side, and it's great to see my cousins and all of that. It's been quite an honor to deliver thousands and thousands of babies to people down here, and I remember being at a high school football game when my daughter was in band and stepson was playing football, and thinking, wow, I probably delivered half of the children that are on this field. And it's really quite an honor to be able to think about all the people's lives that I've touched, and I hope that continues for a long, long time.